Good evening. What can you tell us about the Catholic Church's position regarding the Liverpool Care Pathway?
The Liverpool Care Pathway, now on version 12, contravenes Catholic teaching.
Please explain.
The Church states that nutrition and hydration, even when administered by artificial means, these are forms of natural care.
I see. So in Catholic teaching, food and water are not removable clinical treatments.
Even though the LCP has ostensible safeguards which may appear to protect a patient's access to fluids, arbitrary, ambiguous, discretionary terms, like in the patient's best interest or not detrimental to patient, mean that any clinician, diagnostic team, ethics committee or post-prognosis, any other medical staff may remove that hydration tube. The dehydrating agent hyoscine is also used as an anti-nausea drug. Removing fluids reduces the effect of morphine, as organs and muscles begin to dry out, shrivel and the patient dries to death in agony.
But what does the Church say about pain relief towards the end of one's life?
Catholic teaching is that opiates for pain relief must be needs-based and must not unnecessarily sedate anyone in their final hours. Pius XII, in his 1957 speech to the anaesthetists, said unnecessary sedation of patients is a deplorable practice repugnant to Christian sentiments and is ultimately gravely evil.
The Liverpool Care Pathway has prognosis-based opiate provision rather than needs-based pain relief.
This can lead to unnecessary sedation and deny the patient the opportunity to die a good, pain-limited, optimally conscious natural death. Continuous deep sedation is rapidly becoming normative practice.
So Catholics are taught: 1. Do not remove fluids, and 2. Don't sedate unnecessarily by over-prescribing painkillers.
But opiates don't merely relieve pain or sedate. For non-cancer patients, Trescott in his 2008 study and Gomez in 2011 reveal that this unnecessary opiate use actually accelerates death. This contradicts what our bishops' conference said on the issue in their end-of-life document, where they said morphine doesn't hasten death. Plainly and simply, the bishops got it wrong. This is a serious issue. This directly contravenes the fifth commandment, thou shalt not kill. Morphine is euthanizing non-cancer patients.
So, from a Catholic perspective, as a form of palliative care, the Liverpool Care Pathway is irrevocably flawed. It is the Liverpool Care Pathway's use, not just its abuse, which is directly contrary to Catholic teaching.
Yes, and even more so, it is directly contrary to Catholic teaching on the sanctity of human life in one particular way, when it begins irreversible end-of-life procedures after a 72-hour prognosis. To quote a leading contributor to the Catholic Medical Quarterly, once you are on the Liverpool Care Pathway, you will die, even if you weren't dying. We need to face the truth that the LCP is a form of backdoor euthanasia.
Anthony Cole, chairman of the Medical Ethics Alliance, has also expressed grave concerns on the LCP.
Yes, he argues there are hardly any circumstances where fluids need to be withdrawn, that opiates become more toxic, consciousness is impaired, and the suggested morphine doses are too large for the frail and elderly, that there is no provision for a truly independent second opinion, and informed consent is virtually ignored to the extent of non-existence,
as the audit showed,
and who are very often inexperienced staff.
There is also no required training for anyone using the LCP.
Plus, there is no certainty of determining the imminence of death, especially in the elderly with multiple pathologies and post-mortems revealing death by different causes to the presumed diagnosis.
So difficulties will arise also in this procedure from a lack of continuity in care.
Dr. Cole tells us is that inexperienced, untrained staff will be stopping fluids and giving powerful drugs with lethal effect.
This is deeply concerning.
Relatives will be ill-informed, suspicious and sometimes embittered.
So the LCP should be used only with great care and only by trained experienced doctors who are humble enough to listen to a truly independent second opinion.
No doubt it has a place in hospices, but to roll it out in all settings will lead to many premature deaths.
Natural death with consciousness to the end should always be sought for spiritual and family reasons.
The LCP does not exclude this, but it doesn't exclude that which is dehydrating, poisoning and putting to sleep either. Finally, Dr. Cole leaves us with a devastating prediction. Palliative care itself could be discredited and it could play into the hands of proponents of euthanasia.
But some senior Catholic ethicists strongly support the Liverpool care pathway, don't they? Saying it conforms to Catholic teaching and that those who oppose the LCP are scaremongering and playing into the hands of the pro-euthanasia lobby.
Let me explain. The Liverpool care pathway is backdoor euthanasia. But Catholic ethicists, medical and charity quango professionals, senior clerics or Catholic commentators, even pro-life activists, are denying it is euthanasia, and dismiss every concern and seek to suppress any opposition to it.
And we have to ask why they are so hostile.
The answer is they want to save more lives.
They are scared and they don't want active euthanasia legislation passing through Parliament.
They know that if they say the LCP is euthanizing, it will look like it's a regular normative medical practice in the NHS, and thus make euthanasia easier to become law. And as the LCP is a long drawn-out form of passive euthanasia, a system aimed at reduction in pain and suffering would logically, especially in these days of overriding human rights and financial restrictions, seek to introduce assisted suicide, direct active euthanasia.
The irony.
From the frying pan of the thousands euthanized on the LCP to the fire of the hundreds of thousands euthanized through active euthanasia legislation. Yes, they are terrified of the consequences, which is why they are silent. They are afraid that trying to save the lives of the few might very well kill the many.
Which is why we have at present in this country a conspiracy of silence on the LCP. A whispering campaign against Orthodox Catholic and Christian ethicists, healthcare workers, commentators, activists, bloggers, etc., especially those with high positions in the medical profession, who prove categorically and irrefutably that patients are being euthanized and murdered in unbelievably excruciating pain and distress. And why?
Because, like Caiaphas, the high priest of the Gospels, who said it was better for one man to die than the nation,
thus refusing to defend the innocent Jesus as the price was too high for the people.
The argument is that it is better for a few thousand to die through use, misuse and abuse of the LCP
than for the law to be changed to assisted suicide and active euthanasia leading to the deaths of millions.
Yes, this present formal cooperation with evil by willfully denying the immorality of the LCP, the murder of patients and the deliberate campaigning against those who seek to reveal it being backdoor euthanasia,
is scandalous.
It's redolent of silence about the trains going to Auschwitz.
So what should Catholics do?
If Catholics are to sincerely, authentically claim to be defenders of the dignity and sanctity of life, we must contact our bishops, our MPs. We must express a vociferous solidarity in our neighbours' defence against this
institutionalized genocide.
Yes, and demand changes to the LCP which guarantee that no one is given a death sentence for utilitarian, eugenic or financial motives. Palliative care that guarantees needs-based provision of care and opiate provision with the absolute principle that food and water are forms of natural care and not clinical treatments, which may be withdrawn. If we deprived a pet animal of water and let it die of thirst, we could be prosecuted and thrown into prison. Yet every 4 minutes we remove the hydration tubes from one of our neighbours, until they die of thirst, not from their illness. And we call it dying with dignity?
It's evil, isn't it?
Yes, it's evil. And the evil is increasing because good men and women are staying silent and allowing this evil to happen. It can't go on. It must be stopped. Now.
We must do something.
We have a chance to speak out to save their lives, and in the process save my life, and my conscience, maybe my soul too. Because I know there may come a time when there may be no one left who will speak for me.
Exactly.
The wisest thing in the world is to cry out before you are hurt. It is no good to cry out after you are hurt.
Obviously.
People talk about the impatience of the populace, but sound historians know that most tyrannies have been possible because men move too late. It is often essential to resist a tyranny before it exists. It is no answer to say, with a distant optimism, that the scheme is only in the air.
A blow from a hatchet can only be parried while it is in the air.
Yes. Euthanasia means very different things to different people, but that is only because evil always takes advantage of ambiguity. It is praised with idealism and benevolence, with silver-tongued rhetoric about human dignity, respect and autonomy. But that is only because evil is always flattering and flattered.
But some euthanasia activists would claim their motives are innocent and humane and astonished at your describing it as murder.
That is only because evil always wins through the strength of its splendid dupes, and there has always been a disastrous alliance between abnormal innocence and abnormal sin.
1 in 6 of our annual dead die on the LCP, half without any consent from the patient or family.
Help stop this now.
Please.